thank you. My name is Meg Elliott. I work as a trainer and communications coordinator at the UCSF Center for Excellence in Primary Care in San Francisco. That's my professional hat today. My personal hat is that I've been a caregiver for many years for my 9-year-old son who has a disability, and did a lot of caregiving for my dad who had frontal temporal dementia for about 10 years. And so I come with that personal and professional space for you all today, holding that space with my colleague, Pat Mejia. Pat, would you like to introduce yourself? Oh, can't hear you, Pat. Pat's going to go ahead and call it in. I'll go ahead and start introducing her. She's our lovely Associate Director of Training at the UCSF Center for Excellence in Primary Care, and one of my mentors when it comes to how do you navigate being a caregiver in this world. It's such a complex thing that we do. Um, and as we're waiting for Pat to call in, we'd also love to hear from you. In the chat, could you please share your name with us, how long you have been a caregiver, and what is one thing that you do to take care of yourself? And as you're entering your name and what you do to take care of yourself and how long you've been a caregiver, I'd like to tell you a little bit more about us. So we're the Center for Excellence in Primary Care. We identify, develop, test, and disseminate promising information to improve patient experience and enhance that sense of health equity, reduce the cost of care, and joy and satisfaction in the practice of primary care from both the provider perspective and also from the patient end of things and caregiver end of things. And I'm seeing some lovely sharing in the chat. Thank you so much, Sarah, for sharing. I'm so sorry to hear about your mom. And this caregiving brings with it a bittersweet time for those of us who are caregiving, carrying so many hats. And I'm seeing Mihai, thank you so much for sharing that you've been a care provider for the last 32 years. That's quite a long time. And Pat, is your audio working?
I believe so. Can you all hear me okay now?
Yes. Would love to give you a chance
Awesome.
to introduce yourself.
Yeah. So really happy to be here with you today. As Meg said, I am the Associate Director of Training at the UCSF Center for Excellence in Primary Care. But I come by way of actually my personal hat. Previous to arriving at UCSF, I worked for about 15 plus years as a non-clinical case manager for families of kids with disabilities and chronic healthcare needs at a parent-to-parent organization. I have been a caregiver for my daughter, Nina, who is almost 40, still shocking. And so I've been a caregiver for her for about 40 years. She is the one that kind of opened this world up to me and allowed me to walk the path alongside her, sometimes behind her as she trailblazed away. And then more recently, I was a caregiver for my mom when she had cancer, and then more recently, caregiver for my dad who has dementia and moved in with my family a couple months ago. So, just really happy to be here with you all in shared space. And yes, Cindy, a nap sounds so good pretty much anytime, right? So I will turn it back to Megan. Please keep sharing in the chat. We'd love to learn more about our audience, especially when we're in, limited time spaces. This is a nice way to get to know each other.
Thank you so much. And you can go ahead and advance. Thank you. So keep sharing, keep that sharing coming. We really love to make our trainings as interactive as possible. I know we just have a short amount of time, so you're going to see us flying through some content. But please do share in the chat your questions, your comments, and also take care of yourselves. Stretch, breathe, stand up, move around, and let us know if you need support. And our agenda for today, just a little bit of an overview of health coaching skills that Pat will jump into shortly. Then we're going to hop right into practicing some skills that we would like to use as caregivers and as patients with providers. So setting the agenda, a little bit of practice with that skill, and then our second skill of the day, which is ask, listen, tell. And then if our time allows, we'd love to get some practice with that skill as well, and then save some time for closing at the end. So I'm going to turn it over to Pat.
All right, and I do want to encourage folks, I see a handful of folks with their cameras on. If you're in a space where you feel comfortable turning your camera on for us, that would be great. It just really increases engagement for everyone. So Bill and Soren and Wayne, and I feel like I miss Marianne whenever I do that, but thank you, really appreciate it. Thank you, Cindy, for turning it on. All right, so we are at the UCSF Center for Excellence in Primary Care. Part of what we do is we teach health coaching skills to folks in the clinical settings. So these skills were developed, they were born out of motivational interviewing, but really kind of tweaked and further developed to really work within healthcare. More recently, we have done work around health coaching as a supervisory tool in the work setting. We've done health coaching for self-advocates, so patients in the community going into these spaces. And this is the first time it's been a thought in the back of the brain for a very long time, but we haven't formally done health coaching specifically for a caregiver audience until today. So we are testing the waters with you all. Would love your feedback at the end. All right, so to get us going, when we talk about health coaching skills, what we are talking about are 3 central principles. And as caregivers, this is kind of where I see a big difference between the different audience that we have trained before, because as caregivers, we're kind of that middle ground, right? We're that bridge. And so in health coaching, we look at being patient-centered first and foremost. It is the patient who is driving this ship. Driving the car, steering the ship, I always cross those two. But it is the patient that is front and center. And so how do we as caregivers ensure that that voice is in the room? You know, whether we're talking about a child, preparing my daughter for her IEPs, for example, when she was really, really little, she didn't want to be in the room. Her ADHD was off the charts. She just wouldn't be able to sit through an hour, 2-hour long meeting. So we would do a little bit of interviewing ahead of time. What's important to you? What's working? What's not working? And that's how I would bring her voice into the room. For my dad, we will talk about an agenda before we go into a clinic space. Will he remember that agenda that we did the day before? No. Do we talk about it that morning? Yes. Do we talk about it on the car drive in? Yes, because as you all know, for folks who work with folks like my dad, it's gone, right? It's gone that quickly. And so, but the idea really is that preserving his dignity and his autonomy as long as I can. So building that agenda together. So we will talk about that a little bit more in a bit. Health coaching also comes from the idea of being strength-based. So that idea of what do patients bring to the table? What can we support them in growing? So as they work towards, their healthcare goals, and then being collaborative. So recognizing that everyone in that space, including us all as caregivers, plays a role, right? So the clinical side, they're going to bring their medical expertise into the room. The patient is going to bring their lived experience in the room. And then we're also going to bring kind of that backup voice to that patient of and working collaboratively together as a team, which I know sometimes can get sticky, but we've heard from clinicians that they really appreciate when folks kind of come with these tools. So we're going to share these with you in just a sec. The other thing I want to say before I hop on, like Meg pointed out, we usually do this training in like 2 hours time. So we're skating through really quickly, but please, 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 we want to make this beneficial to you. Please drop questions in the chat, raise a hand if you have something. If we're running low on time, we will put it in the parking lot, but we really want to make this work for you. All right. So this is the fun part. Meg talked about this being very interactive. It's the afternoon. You've been here all day. We want to bring people's energy up in the room. So I'm going to look for 2 former theater kids or wannabe theater kids, anyone in the room who feels comfortable playing either our provider or a patient/caregiver. All you have to do is read your role. You can punch it up with some acting chops if you have them. But who would like to be our provider and or patient caregiver? Ann H, is your thumbs up I would like to volunteer? And Ashley, amazing. All right. All right, so let's see. Anne, which role would you, since you volunteered first, which role would you like to play? Provider or patient caregiver? And Anne, if you're speaking, we're not hearing you. All right. I'm going to go to Ashley. So Ashley, did you want to choose which role you wanted to play?
I can be the provider.
All right. So who would like to be the patient? I'm going to give it one more try. Who would like to volunteer to be Ashley's patient and or caregiver? Going once?
I will.
All right. Thank you. All right. So Ashley, when you are ready, go ahead and take it away.
Okay. Hello, thank you for coming in today.
Oh, we're not hearing your voice.
Me?
Hi,
No,
how
Ashley,
are
you're
you?
good.
I got it. Hi, how are you?
Good, just really busy this morning. Was there anything you wanted to talk about today? I'd like to review your most recent labs, and it looks like you're due for your flu shot. We should get that taken care of.
Well, there was something I wanted to talk to you about, but I seem to have forgotten what it was.
That's okay. When you remember, just let me know. Okay, let's take a look at those labs.
And then the appointment ends, ... All right. So how many folks have lived this experience before? We know what we want to talk about. We've maybe talked to other people about it, and then we get into the space and we either forget or things get too busy. And I'm going to raise two hands, as I always do, because I've done it in behalf of my daughter. You are very welcome. So this is such a common thing, right? We are super busy. Our appointments tend to be very quick sometimes. And so it can be really, really easy to have that thought, and if we don't write it down, to lose it. So what can we do for that? So would love to hear from folks. You could drop it in the chat, and I'm loving all the emoji interaction. All of it is good. Emoji it, drop it in the chat, mic up. When you hear the word agenda, what comes to mind? What does that make you think of? Let's see, Dory, I try to write things down ahead of time and take it with me. Awesome. Ashley, I write notes for myself on my phone so I don't forget. Ashley, I just started doing that. So technology, amazing. Awesome, and forgive me if I'm saying your name wrong. Making a list, it's a list of to-dos. Absolutely. So we all kind of know what an agenda is, right? We're basically just putting together a list of things, in this case, that we want to make sure to talk to our provider about, right? So we want to come to those visits prepared. I'm getting a sense of this in the chat, but if folks want to go ahead and keep dropping in, whether they are a yes or sometimes or a no to doing agendas now, I fall in the sometimes camp. I'm going to be totally transparent. Sometimes it's in my head and I think that's enough, and then scenario plays out like it did earlier. All right, so when we're talking about setting the agenda, and again, we're going to kind of go back. I love the Sean, I love the usually. Yeah, that's me, I'm in that camp. We're going to go back to that whole idea of our role as caregivers. So we want to make sure that for as long as possible that we create this agenda with the patient as much as we can. And that's going to obviously vary patient to patient. And I'm saying patient, it could also be a loved one. I'm not sure what roles folks play, but really working together to create that list. Again, I gave the example of my dad where, you know, he's having a good morning. We know we're going to go see the podiatrist, the next day. Hey, Dad, what would you like to talk about? He might give me something. I might give him an observation that I've made, ask his permission to add it to our list, but we build it together. And again, is he going to remember when we get into the room? No, but that's the beauty of having it written down. Or Ashley, I just share my telephone screen with him now, and that just makes it more convenient. So again, giving him the power and that autonomy for as long as we can. And when we're talking about building out those agendas, you know, I'm sure you all have a million different examples here in terms of what you can include, but commonly it's going to be, what are those questions that have come up for you? What are things that you are unclear about? Maybe something has changed since your last visit to the new one. You want to make sure to discuss that. Maybe it has to do with medication or medication refills. Lots of forms, right? When we're talking about things like durable medical equipment, I just had a little fiasco this week, making sure that that paperwork is filled out, and then any resource information that we may need. And that list could probably keep on going. And then how do we use it during the visit? So this is where, when we talk about health coaching, we're really talking about turning the traditional model of healthcare on its head. We know that healthcare, and we didn't include the statistics that we normally include here, which is a note for us, Meg, for next time. But we know that 50% of folks that leave a visit do not remember everything that was discussed. They don't remember the next steps. As much as we think we're remembering during the visit, as much as we think it's clear on that after visit sheet, oftentimes we get home and it's like, oh shoot, I don't know who's making that call. Is it me? Is it them? Is the clinic going to call us? And so really having that ready ahead of time. Looking at patients and caregivers as true partners in their care means that you have the right to go into that room and start off with your agenda. Hey, how's it going? Great, I have a couple things I'd like to talk about. And on the flip side, with clinicians, they actually really have told us how much they actually appreciate that. Clinician is also always going to have the items they want to talk about. You want to make sure to share it, and then you negotiate your time together, right? If we have that 15-minute visit, we may not be able to get to everything, but at least letting them know what's on our mind, and then talking about what we can cover today and what we might need to get back to later, okay? And Ashley, I'm seeing your comment in the chat. When I was taking care of my dad, and Ashley, I'm going to just go ahead and invite you. Do you want to share a little bit more with the group?
Yeah, I can do that. So he ended up being diagnosed with brain cancer last November. And so I flew to Montreal to take care of him. And luckily, Oregon has a paid leave benefit that pays you up to 12 weeks of your salary. So I was able to go spend time with him and still get paid for that. So that was really beneficial. But their system is just a lot different than it is here, and having to figure out who to talk to because um, it seems like each of the hospitals has their own thing that they do. So like one hospital will be like their neuro institute where he spent most of his time, but then he was in a different hospital that doesn't do that kind of stuff. And just trying to figure out who to talk to was a real challenge. And then they had also um, even like their own social workers within the community. So luckily he had their phone number and I could talk to them, and most of them spoke English. And that was another thing, was the language barrier, because in Montreal, most of the people in Quebec speak French. Um, and that was a whole challenge in itself. So
Yeah, absolutely, absolutely. The reality is we're not dealing with one clinician, right? And in your case, it's a completely different healthcare system to begin with. So all those, even more reasons, and we're seeing some beautiful examples in the chat of different ways that people prepare. So absolutely, and thank you for sharing that, Ashley. And I'm so good on Oregon, amazing that they are so considerate of family care. That's beautiful. All right. We're going to keep plugging away because I want to make sure that we get through both skills today. So again, we just kind of went over this. It's really all about being prepared to share your loved one's concerns. Providers going to share theirs, and then how do we negotiate and work together, right? So again, it's also evening out that playing field of let me have some say in that too about what we're going to talk about. All right, so would our actors care to reprise their roles for us? So the first example was agenda setting gone wrong, because there was a lack of an agenda. So let's go back, and this is a 2-pager. So if I can have Ashley and Possum go ahead and reprise your roles and take us through this one.
yeah, are you ready?
Yes.
Okay. Hello, thank you for coming in today.
Hello. We wrote down a couple of things we'd like to discuss with you today. I know you have things you'd like to discuss with us too. Should we make an agenda?
Great idea. What would you like to talk about today?
Well, my friend's shoulder has been hurting, and someone told us that we could get help with transportation. What would you like to discuss?
Thank you for sharing that. So I have shoulder pain and transportation on the list of things to discuss. I'd also like to review your latest lab results, and it looks like you're due for the flu vaccine. Would you be okay to add those to our list?
Sure. Can we start with the shoulder? It's been pretty painful.
Absolutely. We could then review your lab results and talk about the flu vaccine. I can have Monica, our social worker, talk to you about transportation after our appointment. How does that sound?
Sounds great.
All right. So what did folks pick up on there? What was different from the first round? And feel free to mic up or drop it in the chat. And Sean is sharing shared setting of the agenda. Yep. More caring from Dan and Marty. Cindy, yes, there is a true conversation happening, right? Oftentimes we go, it's not uncommon for folks to go in, we get that white coat syndrome, and it's whatever the doctor has to say, right? They're the ones that know better. They're the ones that have all the information. I just sit passively and listen. And we're saying, no, we all have a role to play here. And actually it's more beneficial all around if we play that role. Let's see, Ashley sharing collaborating between provider and patient, more empathy and supportive listening, more listening and interacting. Absolutely. So again, we are making sure that that conversation is happening. All right. Excellent. And now we're going to open it up again very quickly. We are going to invite a couple of folks. I'll go ahead and be the clinician. But we're going to practice setting an agenda here right now, okay? So who would like to play the patient? And then I will kind of explain the directions. It's really simple. It's almost like reading what y'all just did. Who would like to be our patient? I'm a very nice clinician, by the way.
I can.
All right, awesome. Thank you
I
so
was trying to
much.
mute myself since I haven't participated. I was going to say I can, but she can do it.
Oh,
No, go ahead. I'll give you a chance. Go ahead.
excellent. Thank you. All right, Gisela, great. Okay, so Gisela, you are the patient, and you're going to practice setting the agenda. Your two agenda items that you so lovingly wrote down ahead of time are that you want to speak about the fact that your loved one has developed their redness and rash on their backside, and that you're a little concerned that they are eating less than normal, okay? Below those two talking points that are on the screen, you see that orange peachy colored table. This is kind of the steps. And Gisela, you are welcome to use, step one and then the sample language that accompanies it, or you can do it totally off the cuff, whatever works better for you. But we wanted to make sure that folks have models because we know we're flying through this quickly.
Okay, so
All right,
just
so,
pretty much going to read the sample language.
You can do so, Gisela, if that makes you more comfortable, because we know
Yes.
we just reviewed it right now.
Yes.
All right. So I'm gonna welcome Gisela. Good morning. Thanks for coming in today. Good to see you.
Hi, yes. I have made a list of things that I would like to talk about today. I know I have things to talk about. Sorry, I'm all lost now.
It's okay.
All right. Hi, I'm here because I have some things that I would like to talk to you about.
Great. What would you like to talk about, Gisela?
You said my son has a rash, right?
Yeah, it could be your son or anyone else. Yeah.
All right. Yeah, I came in because my son has this weird rash on his back, and I have tried everything to, to keep it to try to get away with like ointments, and I don't know what else to do.
Okay. Is there anything else you'd like to talk about?
No, that's my main concern at this moment that I can think of.
All right. And so Gisela, this might be a really good place. And I love that you kind of brought in a little more detail into a more reality into the scenario. This might be a really great place to say, you know, can we make a list of things we're going to talk about today? So that you make sure that the provider is working an agenda with you together. How does that sound?
Yes.
Awesome. All right. Beautiful. So let's round of applause for Gisela. Thank you for stepping in to do that. And Meg, I'm looking at time. Do we have time for one more, or should we go ahead and switch?
I think we have time for one more.
All right. So I'm going to ask for one more volunteer. And Possum, if you'd like to step in, or someone else who hasn't had a chance yet, we're going to do the same exact thing, except we have a couple of different agenda items. Who'd like to play our patient?
Anyone else? I'll step in.
Possum's
Okay,
ready to go. Let's go for it. All right, so Possum, this time you are wanting to restart in-home physical therapy, and you're concerned that your loved one has a cough that started over a week ago. This time I'm going to be kind of the not so nice clinician who has their own agenda. So, Possum, you're going to kind of help me be a better listener as a clinician. All right. So, hi, Possum. How are you doing today? I got a lot of things that I really want to get through. So if we can just get started, you know, you saw that the waiting room was just packed full of patients.
Well, we made a list of things we'd like to talk about today. And I know you have things to talk about too. Could we make an agenda of what we're going to cover today?
Okay, you said a list of things. Can we just limit it maybe to one?
Well, we'd like to talk about a couple things. We need to restart our physical therapy in home, and we have a cough that started about a week ago.
Possum, we can end it right there. That was beautiful. So exactly. So this is actually from a real lived scenario that a friend of mine dealt with, and she handled it exactly like you just did. So this was not with the clinician, but the conversation happened with the person, the MA who was rooming them. They said, you know, we have like 3 things that we'd like to talk about, and the MA said, the clinician's really busy today, can you do one? And instead of arguing, you know, it just said, nope, we have actually 2 things, this and this. And what wound up happening when the clinician came in the room, clinician was fine talking about all 3 things, and they made it through during the visit. So beautiful way of, you know, asserting what needs to happen, right? Even if the clinician had come in later and said, you know, I really am busy, could we talk about let's look at the cough, and then could we come back to the in-home therapy? At least they're aware that those 2 items are hanging out there, right? Excellent. Beautiful. Thank you so much. All right. And it looks like, Sarah, it looks like Joanne is having a little trouble with screens. I don't know if you want to check in.
That is interesting. I'll see what I can do.
Yeah, all right. And Joanne, the only thing I can think of is sometimes if you click at the top of your screen, although I'm not seeing it, sometimes it'll say, you know, so-and-so is sharing their screen. If you see that and click on that, sometimes it'll show you the screen, but I'm not seeing that, so I'm not sure. Not sure how helpful I'm being. All right, so before we transition over to Meg, what questions or comments do folks have? And thank you so much. I haven't been able to get through all of the chat. I know there's been some really good information sharing there. But what would anybody like to share? Any comments or questions before we move on to our next skill?
And there's an excellent comment I see from Sean in the chat. Sean, would you care to mic up and tell us a little bit more?
Sure. Sorry, I can't be on camera right now. Yeah, basically it's my question. Like, my mom's recently been diagnosed with dementia. She's still very much mostly with things, but I'm finding that I want to be a part of her medical care going forward. I have guardianship now, for example, and I'm struggling to figure out how to balance the need for me to be in on kind of what's happening with her medically, but also respecting her very strong desire to maintain privacy like with doctor visits. So any
Yeah,
suggestions or advice?
Sean, that's a tough one. And that was kind of the early stages with my dad too. And would love to open up the room to folks. We have a lot of collective wisdom in the room. What have folks found helpful in Sean's situation?
I
Cindy,
have
go
a
ahead.
comment on that one. It's a difficult time for that, and I really appreciate, Sean, your willingness to, or your desire to maintain her agency, and making her decisions and being active in her own care. Um, I, with my husband, I kind of just inserted myself into a primary care appointment. But I also will message his doctors, his providers, so that they know ahead of time, like what may be going on. So if he doesn't bring it up in his appointments and I go with him, they can always say, "Oh, hey, what about this or what about that?" To make sure that all of those concerns that maybe I see that he doesn't are being addressed.
Thank you, Cindy. Yeah, and I know that, and Shauna, it's a tough position to be in, right? Because you're coming at it from such a place of love and caring for your mom. And I know with my dad, even now, sometimes I'll, say, hey, should we make that agenda? And then we get into the visit and he'll say, oh, I don't want to talk about this one. And if, and that's a tough situation to be in. But again, I think what Cindy shared in terms of, we have the technology now, sounds like for all you old school folks, it sounds like Bionic Man, but we do have the technology now of, the EHRs. So if you have like my chart or something where you might be able to can we just, send questions ahead of time? I think that's a really good approach. Hope that's helpful, Sean.
Pat, to that scenario, I think Sean mentioned that he was a guardian.
Guardian, yes.
I'm wondering if
Thank
that gives, if then that allows the healthcare provider to actually have a one-on-one conversation with him without, as that is a possible solution.
Yes, Sarah, thank you so much. I meant to talk about that. And yes, so the guardianship, Sean, you actually have kind of a leg up, so to speak, because that frees up the clinician to be able to talk with you directly without your mom in the room. And I'm sensing a little bit, Sean, that there's also a little maybe concern on your end of still knowing that and wanting to still protect agency, but just kind of recognizing that you're coming at it from a place of love, and there will be a time. The nice thing about doing it early is you're establishing that relationship with the clinician, particularly when, if things start to progress, that you'll kind of be in a position where there's already a relationship of trust built between the two of you. So that might be another way to kind of approach it and think of it.
Matt, to an earlier conversation in the chat, it was the where the mother-daughter in the room with the healthcare provider, and the daughter actually saying things that were not true. And how do you communicate that respectfully with the provider? And
so I can answer that one quickly, just my own example, and if others have more, please, this is such a great place to get support from one another, so please drop it in the chat. My daughter will answer yes to everything. So when COVID first started, have you been out of the country in the last 90 days? Yep. Nope, we have not. And so what I have found helpful, because part of it I think also is building trust with the clinician, because she is the patient, is that I'm always respectful of, I let her answer, and then I'll say, would it be okay if I clarify some information with the doctor first before we continue? And she, is usually fine with that. And then I'll just say, we actually haven't been out of the country. probably really wants to get out of the country, but we really haven't in the last 90 days. And so just kind of making sure that, not jumping in while she's answering necessarily, but kind of coming around. And the doctor, her clinicians have come to expect that. So they will talk to her, ask her questions, and then now they will say, would it be okay if I, get a little more detail from your mom? Which is great because they're still respecting her autonomy and then getting clear information as needed. All right. All right. We are needing to fly. So apologies for having to cut this great conversation off. I'm going to turn it over to Meg, who's going to take us through our second skill, which is Ask, Listen, Tell.
And I'm really glad, Sean, that you brought that in because we're hoping that these skills can, that when you draw in the person you're caregiving for into this process of communicating, even if they're not able to in the way that in the way that you would want to get clear information from the provider, showing that dignity, giving that dignity and drawing them in brings that sense of autonomy. And so that's our hope as we move through these skills. And so we're going to take you into a foundation of health coaching, which is how do we ask questions of our providers? And so I want to talk to you a little bit about close-ended questions versus open-ended questions. Who wants to mic up and tell me what a close-ended question is?
Closed-ended would be, hey, are you doing all right today?
Nope. That's what my dad would have said. Nope.
Or yep. No.
Yes, yeah, exactly. Ding, ding, ding. So close-ended question does not invite conversation. It can be answered with a yes or a no, and usually begins with things like, are you, do you, will you, can you, did you? Did you take your meds today? Nope. And now to get into open-ended questions on the other side, an open-ended question is really something that invites conversation. So it can't be answered with a simple yes or no question. When did you take your medication? How did you take your medication? And it typically begins, we talk about the 5 W's, who, what, where, when, why, and that 1 H, how. So we'd love to practice a little bit so that we can really milk, maybe we only have 10 minutes with that specialist, 5 minutes with a primary care doctor, and just really get as much information as we can when we're in that visit. So here are some sample close-ended questions. Did you like the movie? Let's start with the first one. Who would like to take a try at turning did you like the movie into an open-ended question? Cindy, thank you.
What was your favorite part about the movie?
Excellent. Yes. And these are skills I use with my toddler as well. Instead of, did you have a good day at school? Nope. How was your day? Who did you play with? What did you do? So really, and a trick that we always talk about in our trainings is if you're not sure how to make it an open-ended question, stick a W. Stick what in front of it? Some kind of W word to begin that question. So we'll just show the next examples of how we changed these close-ended questions on the left into open-ended questions on the right. So are you going to be able to stop by today? Turns into when will you stop by today? Can I call you next week? Turns into what would be the next time to call you next week? And I'm curious, here I'm going to use an open-ended question. What questions do you have about that little activity that we just did, or what does that bring up for you?
That happens to us in our family all the time.
What?
We have to use questions that will elicit more than just a yes or no.
Absolutely. Yes. And, we can really experiment with this. And I encourage you, next time you talk to someone that you love, next time you go see your doctor, no matter who you're talking to, do a little experiment and see if you can turn a closed-ended question into an open-ended question. So now we have time for our final skill, and I think that we're actually going to be able to get some practice in with that. So first, before we dive into our last skill of the day, we'd like another couple of wannabe drama kids, Oscar nominees, to play our role of provider and patient or caregiver. Who would like to read for us an example of the way that something might be an open loop when we meet with a provider, the way we don't want it to go? Who wants to volunteer to play provider or patient, caregiver?
I'll be provider.
Oh, thank you so much, Anne. Okay, and who would like to be Anne's patient?
I just have to read off the little dialogue here.
That's right, Gisela.
Okay, I'll do it.
Okay, thank you. And scene. Action.
Okay. Hello, I'd like to go over your new medication today.
Okay, sounds good.
The new medication is metformin. It helps control blood sugar. Any questions?
No.
Great. Start it tomorrow and we'll check back with you at your next visit.
Okay.
Oh my goodness.
Show of hands, does this seem familiar to folks? Full disclosure, this happened to me this past week in an office visit with a medical provider, and I left going, oh. So how do you think that conversation went?
That wasn't very good because you really don't get any information of like assistance of how you're supposed to take it or what are the reactions to the med or anything like that.
Yeah. What is the medication supposed to accomplish?
Well, I bet the provider thinks the conversation went great.
Yeah.
They were in and out and they could move on to the next person, but the rest of us are like, no.
Exactly. And the providers are churning in and out. They're stressed too, so they only have so much time to see so many patients. So, we're hoping that this skill that we talk you through, Ask, Listen, Tell, can really turn this table around. You could advance, please, Pat. Thank you. So what is Ask, Listen, Tell? This is a communication tool that you can use to ask questions and confirm your understanding of the information shared before the visit ends, not when you're in the parking lot going, oh, what was that? So these are the steps. First, we ask an open-ended question, and you all did so beautifully when we practiced turning something into an open-ended question. Then you listen to what the provider has to share. And then this is something, if you've ever heard of motivational interviewing, it's a cousin of health coaching. This is called teach back, or the tell, when we share back in our own words what we understood about the information the provider shared. So you can hear it. It's also called close the loop. And so the way that it sounds is, so here's my open-ended question. I'm having a hard time managing my loved one's medications. What help can I get with that? And the provider might say something like, well, managing medications is challenging. Here are a few options. A comprehensive medication review. You could use a pill organizer. We have some in the office we can give you if you're interested. You can request pill packs from the pharmacy. Those are pre-sorted pouches that have all the medication needed for a specific day and time. And you can use a medication reminder app. And then that teach back, that's me saying, okay, wow, that all sounds helpful. That was a lot of information. I want to be sure I understood all the options. So now I'm going to say it back to the provider. What I heard you say is you can do a medication review. We already have a pill box, but I'm still having trouble. I like the idea of the pill packs and maybe using a reminder app. Did I miss anything? And so that's how that skill might sound in practice. So why do we do this? And we're trying to aim for supporting both ourselves as patients and caregivers and also the provider. So when we close the loop and and tell them back what we heard. That helps the provider understand what we took away from what they shared. It helps them know whether or not they did a good job explaining it, and helps them clarify any misinformation or misunderstanding before you leave the appointment. And on our end, it's to double check to make sure that we understand what came through from the provider, and it helps us actually retain what we heard in the visit if we say it back out loud. And this is based on adult learning theory, where we know if we just have someone going wah, 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 we retain about 5% of the information. But when we actually practice doing it, and this is why Pat and I have been having you practice, and when we teach others back or say something out loud back, then we actually retain, our retention goes way up to 75 to 90% of that information shared. And we're really trying to flip that statistic Pat mentioned earlier of, you know, the statistic is most people walk away remembering maybe about half of what they heard. So you can advance. Thank you. So the way that this might sound at the end of a provider sharing all that information with you is, then I might say, that was a lot of information. Let me share back what I heard to make sure I'm clear. I think you said this, this, and this. Is that right? And another way that this might sound is, I want to be sure I'm understanding what you shared. What I heard is this and this and this. Did I miss anything? And these are phrases that that you can write down and take in with you to remind yourself to close the loop at the end of the visit. And so now we have some practice, a few minutes of practice, just to hear what this can sound like when done the right way, when we close the loop or do teach back that tell part of ask, listen, tell. So who would like to do our final readout of the day? Who would like to play the patient or caregiver?
I can.
Gisela, coming in fast. All right.
I can.
Great. And
I'll do whichever one the other person doesn't want to do.
okay, thank you, Gisela. Okay, and Ashley, would you like to be, well, actually, Pat, do we have the provider points? Let's see, I'm sorry.
Yes, I have them.
Okay, great. Okay, so Ashley, would you like to play the provider?
Sure.
Okay, great. So Gisela is going to play our patient. Go ahead.
I had a question about the new medication. Specifically, what side effects could it cause?
Great question. The most common side effect is an upset stomach. If that happens, you can cut back and take 1 pill a day instead of 2. And be sure to call us to let us know if you have to cut back.
Oh, right. Oh no, sorry, my bad. Okay, so let me be sure I heard you correctly. The most common side effect is upset stomach, and if it happens, cut back to 1 pill a day instead of 2. Did I get that right?
Exactly right. And please call the office to let us know if you've cut back.
Oh, right. We will be sure to let you know if we have any troubles with it.
Excellent, excellent. Thank you so much, Ashley and Gisela. So how confident are you now that the patient, that Gisela understands her options? I'm seeing some head nods, like, okay, now she was able to say back what she understood, and the provider was able to confirm, okay, that's exactly right. Wonderful. Excellent. Dan and Marty, do you have something to add?
I was just going to say that was excellent, and it makes it very clear.
Wonderful, wonderful. Good. So I think we have, maybe 2 minutes to do our final practice. And it's going to be a little bit more of, trying out the skill with something in mind. So here, if you're the patient, playing the patient, and actually I think Pat and I are going to do this one together.
Sure, let's go for it.
All right. Okay.
Looks
So
like we have about 4 minutes, Meg.
4 minutes. Okay, perfect. So,
Sure.
so I'm going to play the patient, and I'm following up with my provider, Pat, about my new diagnosis of diabetes. And I'm going to say I'm not sure exactly what the A1C test is for and why it's important. And I'm going to use Asl-Listen-Tell to talk about A1C with Pat. Okay, so what can you tell me about A1C?
Yeah, that's a great question, Meg. So the A1C basically, there's a few things I can tell you. One is that the A1C measures the level of sugar in your blood over a span of time, so usually 3 to 4 months. It's really important because that helps us just see how your blood sugar is doing and lets us know whether we need to increase your medication, decrease your medication. We can make adjustments accordingly. And then there's also different ways outside of medication that you can adjust your blood sugars, including things like increasing physical activity, healthy eating. So those are kind of the 3 things that are connected to A1C.
Okay, let's see. Oh, wow, that was a lot. I just want to be sure I heard everything you said. Could I share back what I heard?
Yeah, absolutely.
Okay, so A1C is a measure of my blood sugar over the course of a few months. And one of the ways that I can like make my A1C go to a healthy level is by healthy eating and exercising. And what was the other thing you said?
And just the importance of the test itself, because that gives us a snapshot of how you're doing and lets us talk with you about how we might need to adjust medication or physical activity or healthy eating.
Okay, great. So the A1C is a really important test for me to continue to get to measure my blood sugar over time, and also I can do these other things to make my A1C level go to where we want it to be.
Absolutely, you
Did I
got it
get that
exactly
right?
right.
Okay. All right. Thank you, Dr. Mejia. All right. So, so that was a little bit of hearing what that sounds. I'm wondering what questions or what folks thought of that skill, ask, listen, tell. I'm seeing a thumbs up from Possum. I know we only have about 4 minutes left, but would love to just get your take on what you observed, what comments or questions you might have.
This is a little twist on this, but I know that most of the time the 2 of you are talking to clinicians, and I'm guessing you're teaching them the same type of skill. What sort of questions do you get pushback? Do they have questions? What's their response to this, and how might we understand kind of a little bit more of where they might be coming from?
Yeah, so I can share something. So we train, like you said, Sarah, we train from front office to back. So we have a mix of clinicians in the room. It might be the person who's at the appointment desk, nursing, whoever. Folks tend to be pretty receptive because it's helpful to them. What tends to happen, so our clinician-based training has a lot of data points in it because half of what we do at our center is research. One thing that Ask, Listen, Tell, or Ask, Tell, Ask, which is the provider version of it, prevents is wasted appointments. Because what tends to happen is if we go home and we don't understand why we're taking this medication or what it's for or what the side effects might be, and we decide not to pick it up and not start it, 3 months out, when we go back into the visit, we're basically repeating the visit that we had 3 months ago. So they actually really appreciate it. And just quick anecdote, I was with my dad at Kaiser at one of his appointments, and they had one of those electronic information boards in the waiting area, and it actually came up on the board. Closing the loop came up on the board, and I just about fell out of my chair because I was like, yes. So they actually really find it helpful on the other end. Yeah, because it really does give them the information they need to figure out whether you're leaving with a good understanding. And Cindy's adding in the chat. Let's see, we have a couple of comments. Helps remove gaps and barriers when it comes to communicating with provider. Absolutely. Dory, good communication skills to be reminded of. Absolutely. That's all we're talking about, right? We might apply these skills elsewhere already, and all we're saying is bring it in with you to your caregiver appointments. Helps caregivers advocate strongly. Helpful to hear the examples. That's awesome. And Ashley, love the Asl-Listen-Tell should be used across healthcare. We're trying. We do a lot of training of healthcare providers, so we are trying to move things so that folks aren't leaving with that 50% understanding.
And I know,
Any other questions?
Oh, sorry.
Go ahead, Meg.
Oh, I just was going to say, I know that we're ending in about a minute, but I just want to say, kudos to all of you for, taking time as caregivers to try on new skills, or maybe these skills sound familiar to you or you're already using them, but just want to give appreciation for all that you're doing as caregivers. And, thank you for being with us.
Well, Pat and Meg, thank you for joining us too, coming all the way from California via Zoom. We really love the shared learning and the skill set you brought to the conference. I think the level of engagement was just tremendous, and I think you hit it out of the park in terms of really giving us some very practical, applicable skills. Thank you. And I think we'll head back to the main room. Appreciate it.